Understanding your healthcare options during the retirement transition is important. Budgeting for proper medical costs during retirement is a necessity. And it's actually pretty simple to put together a rough budget for it. A study done by EBRI shows that Medicare beneficiaries pay a share of their benefits out of pocket. And in 2015, a 65-year-old man needs $68,000 in savings, and a 65-year-old woman needs $89,000 in savings if each of them have a goal of having a 50% chance of having enough money saved to cover their healthcare needs during retirement. So to have a 90% chance, it's actually $124,000 for men and $140,000 for women at age 65. Let me repeat that. $124,000 for women and $140,000 for men, and this is with Medicare. Now there's another way to look at it. If you're age 65 and you qualified for Medicare, then there are some basic and easy numbers that you can use for your planning. Okay, so first off, Medicare is not as good as we hope for, but it's much better than we think. Medicare is the main health insurance that most retired Americans are covered by. You have Part A. Part A you've probably already paid for if you're fully qualified for your Social Security benefit. And the magic age is 65. So if you retire prior to 65, then there will be an uncovered period for you to figure for unless you have something worked out with your employer. Part B is doctors, Part D is prescription drug. And right now the cost for Part B and D combined is around $120 per month for each spouse if you're not subject to Medicare means testing. Plus you've got a really big need for gap insurance or possibly Medicare Advantage because of what Medicare does not cover. Again, I refer back to the EBRI numbers that I just mentioned. Most people choose gap. It's pretty common for people to choose a plan that runs around an average $150 per month per person. So in most plans, we figure about $300 for each spouse per month at the point of you stopping work. So this $300 per month is for Part B, D, and some type of gap insurance combined. So also a word of warning. If you stop being covered by an employer plan and you're above the age of 65, then you need to apply for Part B and D. The penalty is 10% per year on Part B and 12% per year on Part D, and that penalty is permanent. Another word of warning is to work with a specialist with Medicare when this decision comes for you. I'm a generalist in this area. I'm not a specialist in Medicare. My job is to point you to a person that is, and I have a great team of individuals for this here locally. By the way, this type of information is the type of data that we put into the 4-step framework that I've developed. I call it the financial 4-step, and it helps reduce stress and help retirees answer tough questions surrounding retirement. So if you'd like to learn more about that, you can click on the link. So now you know what to expect for healthcare costs in general for when you are making that retirement transition. So I hope to see you next time.